Hola, muy buenos días, buenas tardes para todos y todas.
Hello, good morning, good afternoon, everyone. Thank you for joining us on this virtual press briefing of the Pan American Health Organization on COVID-19, monkeypox, and other health topics in the region of the Americas today, Wednesday, July 27, 2022. My name is Sebastián Oliel from the Communications Department at PAHO. The session will last about 1 hour. We have simultaneous interpretation into English, Portuguese, French, and Spanish, and you can choose your language by clicking on the interpretation button. We have received your questions by email. Thank you all for sending them, and you will also be able to ask questions if you use the Q&A button. Please always give us your name and outfit and medium outlet. Today, Dr. Mary Lou Valdez, PAHO's Deputy Director, will give us the remarks on behalf of Dr. Carissa Etienne, the director. Dr. Mary Lou Valdez is accompanied today by Dr. Marcos Espinal, Assistant Director, Interim Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies, Dr. Sivan Antiguieri, Incident Manager for COVID-19, and also Dr. Andrea Vicari, Head of the Infectious Disease Threats and Infectious of PAHO. Now, over to you, Dr. Mary Lou Valdez.
Thank you, Sebastian, and good morning, everyone. Thank you so much for joining today's press briefing. I want to offer an update on both COVID-19 and monkeypox transmission in our region. For the first time in 5 weeks, COVID cases have decreased in the Americas. COVID-related deaths have also remained stable, but COVID-related hospitalization and ICU admissions are up in more than 8 countries throughout the region. Nonetheless, infections are still high. More than 1.6 million new COVID cases were reported in our region over the last week, and several countries are still experiencing a rise in cases. Canada reported more than a 20% increase in COVID infections over the last week. In Central America, COVID infections are climbing in Costa Rica and Honduras. We're seeing cases continue to increase in some countries in South America, with the largest surges reported in Bolivia, Venezuela, Ecuador, and Peru. And in the Caribbean, Cuba, Guadeloupe, French Guiana, and Trinidad and Tobago continue to observe increasing COVID-19 hospitalizations and ICU admissions. Just as our European colleagues have been reporting, the Omicron BA4 and BA5 sublineages are becoming the predominant strains in our region and are responsible for a growing number of COVID cases in the Americas. But there's one key difference between the dynamics in Europe and the situation in the Americas, and that is vaccine coverage. Thanks to high vaccination coverage across Europe, most COVID patients have been able to safely manage their symptoms at home, leaving hospitals to care for the most vulnerable patients. Yet here in the Americas, 1/3 of the population remains unvaccinated, and 10 countries and territories have yet to protect even 40% of their populations. Our region must take Omicron seriously and consider adjusting public health measures as needed. Because these strains are more transmissible than the original SARS-CoV-2 strain, social distancing and mask wearing are still effective means to limit COVID spread. Countries, especially those with lagging vaccination coverage, should brace themselves and ensure that their hospitals are adequately prepared to care for an influx of COVID patients. Without adequate vaccination, we leave ourselves and our families vulnerable to this evolving virus. Of course, COVID is not the only disease outbreak we are tracking. So I want to update you on monkeypox, which was declared a public health emergency of international concern by the World Health Organization last weekend. Nearly 5,300 monkeypox cases have been reported across 18 countries and territories in the Americas, the majority being in the United States, Canada, and Brazil. To date, no deaths to monkeypox have been reported in our region. Nearly all cases continue to be reported among men who have sex with men between the ages of 25 and 45 years. However, we should be clear that anyone, regardless of their gender or sexual orientation, can get monkeypox. The pattern of transmission offers a unique opportunity for countries to work closely with affected communities to ensure people know how to protect themselves and what to do if they exhibit symptoms. Unfortunately, early reports are showing that there's a lot of confusion surrounding monkeypox. That's why clear communication is more important than ever before. PAHO is presenting daily updates to our member states and has issued guidance for health workers to manage monkeypox cases and prevent further infections. We are also working with civil society and the LGBTQ+ communities to alert at-risk groups about monkeypox symptoms and to provide information about how they can protect themselves. And as we engage with our LGBTQ+ communities, I want to caution countries about the potential for stigma, homophobia, and discrimination that can impede our public health responses, just as we saw with HIV. The emergence of monkeypox as a public health emergency of international concern should serve as a reminder for countries to remain alert and to work more closely together to bring this outbreak under control. And finally, I want to acknowledge that a vaccine-derived polio type 2 case was reported in the United States. Local health authorities are investigating the case, and PAHO will share further information as it becomes available. It's important to note that our region has been polio-free since 1994, thanks to good vaccination coverage and disease surveillance. However, in recent years, polio vaccination rates have dropped considerably in our region. And today, the regional polio vaccination rate is at 79%, well below the recommended 95% threshold, and the lowest coverage reported since 1994. This is extremely worrisome because without adequate vaccination coverage, our region remains vulnerable to outbreaks. That's why I want to leave you today with a reminder that we cannot afford to be complacent. Being healthy and safe from disease takes concerted action. We must use the tools at our disposal, vaccines, medicines, and surveillance to keep our populations healthy. Thank you again, and Sebastian, back over to you.
Muchas gracias, Marilu Valdés, nuestra directora adjunta de la
Thank you
OPE.
very much, Dr. Valdez, PAHO's Deputy Director. Now we're going to go over to the questions that have been sent to us via email and the ones that are being typed now in the Q&A. And please, I remind you to give us your name and outlet. From Ana Maria Roura from BBC World, Ana Maria wants more detailed information about monkeypox in Latin America. She wants to know how spread is the virus in the region, what countries are more affected, and what vaccines and treatments are available. Dr. Vicari. Thank you very much for your question. I see that the question has several components, so I'll take a little longer to answer it. In terms of how spread is a virus, how much the virus has spread in the region, we have 5,186, and it is Europe continues to be the most widely affected region. While we have seen a gradual increase in cases in some countries, this increase has not been exponential. So I think that we need to keep all this in context of what could be a danger or a hazard in the next few weeks regarding why there are some countries that are more affected than others. Well, we have the United States, 1,500 cases, Canada and Brazil, with about 700 cases each, Peru, 200 cases. It's never easy to conclude why one country is more affected than another. Maybe there are several factors that may come together. Among them, I would like to mention the number of imports from Europe. Since when the transmission is occurring, differences in the areas. And finally, also surveillance of actively seeking for the virus. They all change between countries regarding what countries are better prepared. Well, this is also difficult to compare between countries because ultimately one country needs to prepare according their own conditions and their particular circumstances in this sense. And I would like to emphasize the fact that all countries also continue to confront the big challenge of COVID-19 pandemic. We have had many lessons learned and upon which we can build for the future. And as our deputy director was saying, the fact that monkeypox was declared a uh, a disease of international concern and an emergency is something that leads us to have to follow recommendations. If a country has already reported cases, etc., this becomes an important instrument at this point in time to assess the status of that country in terms of preparation. Regarding vaccines and treatments available against monkeypox, I would like to talk about the importance of the fact that we have other control measures. Even if we didn't have vaccines available, these things will help to reduce transmission. And we've all heard these control measures. These measures are also included in the recommendations that were mentioned earlier, which are related to the declaration of the emergency status. I would like to emphasize that most patients can be treated and there are some vaccines which are second or third generation vaccines developed um, for smallpox that could be used for monkeypox. However, we need to emphasize that the available evidence about their efficacy is limited and also the availability is limited. I think we will be able to talk about what PAHO does to facilitate access to these vaccines. As a final point regarding treatment, and I'm sure there are some available, to be considered for monkeypox. But as with the vaccine, there's not very much clinical evidence and not very much availability. Thank you very much. Thank you, doctor. We have another question also related to monkeypox from Elena Baucar from El Comercio in Guayaquil, Ecuador, and she wants to know, what do most recent studies tell us about mechanisms of transmission of the virus and symptoms about monkeypox? Dr. Vicari, over to you again. Yes, thank you. Regarding the transmission mechanism, epidemiological data are clear right now. While it is important that we don't make people object of discrimination and that we do not focus on certain groups, it is also important to realize that where transmission is going on, because this will allow us to also take actions to contain transmission. So epidemiological data available right now show that 99% of cases are among men, 90, and among them 98 report having sex with men having sex with men, and they have been 98% have been exposed sexually. So and also with multiple partners, etc. While there are other mechanisms of transmission possible with this virus, skin-to-skin contact with people who have lesions in the skin is the modality which allows transmission to continue. And I think it is important to bear this in mind because it allows us to define and see and take a look at what could be the best interventions. Regarding symptoms, well, they are related to this modality of transmission as opposed to the classical clinical description. We frequently see the skin lesions appearing. So this is a rash or and they are inside the mouth, on the face and other parts of the body, hands, the genitals, chest, and there could be general symptoms of a fever, inflammation of the nodes, and headache, and muscular pains as well. Thank you. Thank you very much, Doctor. Now let us continue with other questions. Violeta Villar from the Web de la Salud and Mariana Soquet from Efectos Cocuyo in Venezuela on the chat want to know what recommendations is PAHO given to countries in the region to contain the advance of monkeypox cases. Dr. Ugarte, over to you. Oh, can you hear me? Yes. Thank you, Violeta, for your question, and thank you for the question from Venezuela. I'd like to refer to the temporary recommendations issued by the Director General of WHO that can be applied to different groups of countries according to their epidemiological situation, transmission, levels, etc. But before I give the recommendations, I'd like to emphasize that these recommendations need to be implemented at all times, fully respecting the principles as established principles of dignity of all human beings in all communities. And in this context, those countries that have no history of monkeypox in humans and they haven't detected any for 21 days, they should establish mechanisms of coordination in health and the multisectoral preparation to respond to monkeypox and prevent human-to-human transmission. As in other pandemics, this work, it requires all sectors. It's not only the health sector, it's a multi-sectoral approach. Also, self-reporting, voluntary self-reporting of symptoms should be encouraged, and that these people will have easy access to healthcare services. This has proven to be very efficacious to control outbreaks on an early a level and prevent human-to-human transmission. And epidemiological surveillance should be intensified, looking for diseases, including diseases which have similar signs or symptoms as monkeypox. And this includes, of course, access to diagnostic testing for those diseases which could be similar to monkeypox. And of course, this needs to be in the framework of the how much a country has in terms of resources of this kind. And PAHO has been working with the countries to improve their diagnostic level, as was mentioned by Dr. Valdez. So for diagnosing and early detection, it is important for all medical staff to be appropriately educated and informed about the signs and symptoms of monkeypox so that they can detect them both at primary and secondary and even tertiary level. People may come to any one of those levels, and the health personnel should be acquainted with these signs and symptoms, and also educate the population in general about risk of transmission, especially those groups that are being affected in other countries and which then could eventually affect the other countries. And whenever a case is detected, immediately reported through the channels of the IHR. Those countries that already have had cases, they should implement response actions in order to stop person-to-person transmission. And this includes a priority uh, uh, among high-risk groups, and also implement measures to protect pregnant women, children, the elderly, immunocompromised people, and other groups that are vulnerable, and work with groups that are organizing mass events so that these groups, especially those that could have an additional risk for transmission of monkeypox, so that these groups use measures to reduce risk and for them to communicate to everyone attending what are the measures of control to reduce transmission. And those countries that already have monkeypox should should share uh, genetic sequences of these viruses, and they should share them with the database of WHO so that all countries have this access being possible. And then considering clinical management using vaccines specifically, and use different protocols related to transportation sectors so that those cases can be detected early, especially I'm talking about international import and export of cases, and to be aware at the point of entry so that symptoms and signs are detected at the entry places of countries. We are still in time to prevent this from spreading more widely and for it to have economic implications. Thank you very much, Dr. Ugarte. Now, Ana Lucia Ola and Daniel Colim from Pensa Libre regarding the vaccine for monkeypox. Ana Lucia asks, who would be the first people to receive the monkeypox vaccine? And another question is it necessary to have a mass vaccination approach given the most recent declaration of an emergency? Dr. Vicari. First of all, yes, thank you. I'd like to repeat what I said before. We have measures of control. If we implement all these well, we will be able to accomplish our objectives to prevent transmission. This is important. I think there is a high expectation regarding vaccination, but and it may become an important instrument, but not necessarily will this be the only thing. Additional measures are specified in the report committee, which was published when the emergency was declared. Vaccination, yes, could be an additional element. We always make a distinction of what could be vaccination before or after exposure, what we call uh, post or pre-prophylaxis exposure. So if someone is in contact and knows they have been in contact with someone who had the disease, the vaccine would be for contacts, especially for domestic contacts and sexual contacts, etc., and those cases in the community. And uh, uh, post-exposure prophylaxis would include healthcare workers who may have uh, had been exposed. And so in this case, it's important to have the PPE equipment regarding the pre-exposure prophylaxis. In other words, someone who doesn't know whether they have been exposed or not, they this could include healthcare workers who have a high risk of exposure, um, people in clinical laboratories who do the diagnostic tests, and as we've seen in other countries such as Canada and the UK, uh, and even in the United States, the high risk communities and which have a high risk behavior regarding the modality of transmission, which is prevalent at this point in time. And in particular, then we will talking about men having sex with men and who have multiple sex partners. And regarding finally the need to have mass vaccination campaigns, there is no recommendation at this point for a general vaccination of the population. The risk for the general population is very low at this point in time, and therefore we are not recommending mass vaccination campaigns at this point in time.
And it
And
is
I think
quite
it's
like
very unlikely that we will be there at any point in time. Thank you.
Thank you very much, Dr. Vicari. We have several questions regarding the acquisition of the monkeypox vaccine. Mariana Rosario from O Globo, Brazil, Gabriel Araujo from Reuters, also in Brazil, Roger Murillo from Costa Rica, and also from Reuters in Mexico, as well as Samuel Fernandez from Polio in Sao Paulo. They would like to know then what efforts PAHO is carrying out to stop the spread of monkeypox and whether there are any negotiations on behalf of the countries, in particular in the case of Brazil, how many countries in the region have expressed their interest in obtaining, acquiring vaccines, and whether it will be possible to have vaccines this year given the significant global demand. Dr. Espinal, can you address this? Yes, thank you very much, Sebastian, for those questions. And I would like to thank the journalist who asked those questions. First, I would like to underscore what my colleague, Dr. Vicari, just mentioned. It is not a vaccine that we recommend for the population in general. It is a vaccine that may be used post or pre-exposure to already defined cases. So the important message is that it is not a vaccine that is recommended, such as the one that is used against COVID-19. The other measures that are widely recommended and are the most important, as Dr. Vicari just mentioned, to interrupt the transmission of the virus. However, the organization is very proactive to obtain access for our countries to the vaccine if they decide that they do need such a vaccine, because it could also be helpful in case of confirmed case contacts. Now, PAHO's director met with all of the health ministers from the region 2 weeks ago, and they were all presented with everything that has to do with access to the vaccine. They were also presented with the technical, regulatory, legal, program-related aspects, because this is not just having the vaccine right now. We need to establish certain parameters, the risks, and all that. So as Dr. Vicari mentioned at the beginning, it is a vaccine with limited evidence of efficacy and efficiency and effectiveness. So we need to be careful. The ministers took note of the relevant information, and they decided to analyze the information based on their context and come back to PAHO. There are 10 countries to date that have indicated their interest in acquiring the vaccine, and at the same time, we are waiting for others to get back to us. The organization is well advanced in negotiations with the producer of one of these vaccines. We should recall that there are different types of vaccines: first generation, second, and third generation vaccines. The first generation vaccine is not recommended for use. This is the vaccine that was used many years ago with pox. And the other one is also recommended for pox, but it has also a very important impact on people that have immunodeficiencies, and also the techniques for administrations are not recommended. The third generation vaccines have already been approved by several regulatory agencies. They are recommended for use, and we are in advanced negotiations with the producer. So this is on behalf of our revolving fund for vaccines. Once again, I would like to highlight that monkeypox is not spread through the air. It is spread when people are in physical contact with other persons or with who are infected, or with an infected animal, but it will not be spread as COVID used to spread. And finally, in connection with such a vaccine, regardless of the fact that there are challenges with the vaccine, the countries will make their decision, and PAHO will support them in their decision to implement the vaccines with the proper recommendations, and also with the programs to monitor adverse events, everything that has to do with effectiveness of the vaccine as part of the program aspects. I think, or I don't know if I have answered all of the questions. I have several. And finally, I think that there is something I should add. We are hopeful that we will have vaccines this year. Negotiations are underway, and we do think we will have vaccines. They will be in a limited number. They are not going to be mass vaccines because we only have one producer, but we will make sure that the vaccines will be available once we reach an agreement with the producer. Thank you. Thank you, Dr. Espinal. The next question is by Rail Russell from Tribune in Bahamas, and in English, the question is as follows.
Health has said it is working closely with PAHO in regards to monkeypox. So what recommendations or strategies does PAHO have in preventing an outbreak of cases in the Bahamas? Dr. Ugarte?
Thank you so much. There are several strategies, and I mentioned previously some of the measures that the countries may take. But regarding PAHO, we developed and shared EPI alerts, EPI updates, but also we trained the laboratory technicians from all member states from the Americas on diagnostic, but also we provide laboratory supplies and others. One of the most important aspects of PAHO's response and PAHO's support to member states like the Bahamas, for example, is to exchange updated information and detailed information on what is happening at the global level, at the regional level, but also which are the main successful responses from the countries that do have a high number of cases. In that regards, I would like to highlight that this week, 41 countries, 32 from the Americas are meeting in Brasilia to analyze which are the best approaches on surveillance, alert, and response to pandemics. And one of the areas that they will discuss this Friday is specifically how we align our response on monkeypox, on the detection, the diagnostic, the clinical management, vaccination, and also, of course, the public health measures that are clearly one of the best approaches that we will have to implement on this outbreak. Thank you.
Muchas gracias, doctor. Seguimos con la siguiente
Thank you
pregunta.
very much, Doctor. We move on to the next question by Melina Ochoa from UNO TV in Mexico City. Similar question by Blanca Valadez from Milenio in Mexico. The questions have to do with the number of cases of monkeypox in their country, whether we see that Mexico has seen 60 cases reported of the disease, and also what is PAHO's estimation of the danger of monkeypox? I think that we have already addressed this question, and also whether in Mexico, men are part of the group that have the highest transmission in Mexico. Dr. Vicari, could you please address the question? Yes, certainly. In principle, we do not have any surveillance system that is different from the one that Mexico has. We do not have information that is different from the one provided by the Secretariat of Health of Mexico. I would like to underscore that Mexico has been a pioneer in confirming cases, and they have also supported us in granting many countries in the Americas, in Central America, and also in the Caribbean, this capacity. So Mexico, in general, has a good surveillance system, epidemiological surveillance system that we can rely on, and we hope that the concerns can be addressed from that point of view. As to the danger for the population in general, this is similar to what we see in other countries. It is quite low at this point in time. It is considered low, but populations that are affected, such as men having sex with other men, the risk could be higher, and it is also important that there is participation so that the communication can be spread to these groups, but clearly this may also affect other groups. So at this point in time, this is the information we have, which shows that the modality in Mexico for transmission is similar to what we are seeing in other countries too. Thank you, Doctor. And also, journalists are asking us about the trend in COVID-19 transmission. The Health Secretariat informed that the cases are going down and that soon enough we will have a decrease in the number of deaths. They're also asking whether we see this reduction at PAHO. Dr. Aldiguieri, thank you very much for that question, and I would like to go back to a comment made by Dr. Vicari. We work closely with the authorities in general, and we have access exactly to the same databases for Mexico. Within this context, there was a decrease that was reported for new confirmed cases during that week, as opposed to an increase that was reported during the previous 10 weeks. So then more than 9,000 cases were reported, which shows a reduction that exceeds 6% as compared to the previous week. And over the last 14 days, almost 237,000 active cases were reported. That is to say, a decrease of 7%. And this is the first decrease after weeks of continuous transmission. As of July 29th, the national hospital occupancy was reported at 18% for general hospitalization beds for COVID-19, and as to the occupancy of beds with respirators, it is at 5%. And the states with the highest occupancy were Oaxaca, Querétaro, and Aguascalientes. And I would like to conclude this brief comment by saying that the key actions to maintain the downward trend continue to be the same public health measures that include the wearing masks in closed spaces and public transportation, and also access to vaccination for risk groups, and also following the federal guidelines. I hope I have provide proper characterization of the problem in Mexico. Thank you. And now to continue with COVID questions, Elena Bancarde from El Comercio in Ecuador would like to have more information about the current situation of the outbreak in the Americas. Can we say that we can reach a plateau and that we will continue to have a reduction over the next couple of weeks? She's also asking about the genetic conduct of the virus. We have seen that Omicron has led to several sublineages, and she's asking, what is the explanation for the genetic variation of Omicron, and how is this related to BA4 and BA5? Dr. Aldigueri, thank you very much. I have heard several questions, and I'll try to disaggregate them by groups. As indicated by our assistant director, last week was the first one to show a plateau after 5 weeks of increase in cases in the Americas. As usual, we do have a mosaic of different profiles depending on the subregions in the hemisphere, the countries, at the subnational level too. Now, as previously indicated, we know that the Omicron variant has a high transmission capacity as compared to previous or earlier variants, including Delta. The more the virus is transmitted, communicated, the more chances we have for changes in the virus that would lead to the sublineages, but that in general maintain a pattern that is similar to the characteristics given to Omicron. Some of the additional mutations that we have seen with Omicron BA5 are related to an advantage in growth of about 1.5 higher than other Omicron sublineages. BA5 has also an ability to have additional immune response that accounts for 10% as compared to other lineages. It is not a drastic change, but those characteristics added to a decrease in protection and also the de-escalation of many protection measures and public health control measures have allowed BA5 as a sublineage of Omicron to compete successfully against other sublineages and become the predominant, the prevalent sublineage regionally. It is expected to see some infectious events with this virus, even in vaccinated patients. However, we should recall that the vaccines continue to be highly efficient to avoid severe cases of disease and to diminish mortality. Therefore, they continue to be a key tool for control of the epidemic. I hope I have addressed the several aspects behind the questions of El Comercio. Thank you, Doctor. The next question in the chat by Brendan Oboy from Reuters in Mexico in English.
Childhood smallpox vaccination rates in Latin America play in curbing the spread of monkeypox, if at all? Dr. Vicari?
Yes, thank you very much for the question. I think it's important to first to say that smallpox was essentially eradicated declared eradicated in 1980. And of course, towards that goal, there was a very large vaccination efforts done throughout the world that were essentially done in childhood as well, but as well in terms of mass vaccination. So we can consider that in principle, people that are roughly 50 years or older may have been vaccinated when they were children back in the 1970s, 1960s against smallpox. Which is, of course, smallpox virus is related to a monkeypox virus within the same family of orthopox viruses. And so it is thought that a vaccination against smallpox could as well protect against monkeypox. However, these are really, there are a lot of uncertainty related to these. First of all, to know whether someone who was vaccinated 50 years or so against smallpox will still be protected today. And so this is definitely a part of uncertainties that we need to consider as well. And the other part is as well to know, to which extent protection against smallpox through vaccination will as well protect against monkeypox in that sense. And so there are, in theory, it's possible, of course, that people over 50 may have some higher degree of protection against monkeypox, but I will not count on that in terms of a strategy, if you want, to prevent monkeypox. And just a final observation, among the 12,000 cases for which we have age data at the global level, 1,400 are actually older than 50 years of age. So we are seeing as well monkeypox cases in people aged 50, 60, or even 70 years. And so it doesn't say much in terms of whether there is a lower risk, but it just shows that it's possible as well in people who probably were vaccinated as children against smallpox, that they do have as well monkeypox, as well reported as having monkeypox in these outbreaks. Over.
Just to add, Sebastian, to that, if I may. In addition, so there has been a couple of also in previous outbreaks of monkeypox, not related to this one, that were people that were vaccinated for a smallpox also experienced monkeypox again. So experienced monkeypox. So in other words, the protection may be, but it's not a full protection or so, and it will fall back. Thank you.
Gracias a ambos. Siguiente pregunta es de Gabriela Solorzano.
Thank you both. The next question is by Gabriela Solorzano from Canal 12 in Nicaragua. In connection with COVID-19, Nicaragua had a mild reduction over the last 8 weeks, but they had an upward trend over the last week. How can you explain this? Is it Omicron that continues to prevail, Dr. Aldigueri? With pleasure, let me address that question in connection with Nicaragua, but it is also important to place Nicaragua in terms of the health measures in Central America, and where we see important, significant differences in connection with new reports of COVID-19 cases over the last week 29, and this is something that we have published today on PAHO's website. 2 Central American countries, Costa Rica and Honduras, have reported an increase in cases of between 10 and 16%. And 3 other countries, Panama, Guatemala, and Nicaragua, have reported a decrease that ranges between 13 and 40%. 13 and 14%. So this again has to do with the Omicron circulation. That is the only variant circulating in Central America at this point in time. And as we know, that variant has the ability, high transmission ability, that adds to its capacity to evade the immune response. And I think that I had already mentioned this during the question from El Comercio. And this means that it can easily spread and even lead to reinfection. And even though reinfections are expected, In vaccinated individuals, it is always important to bear in mind that a full vaccination schedule reduces significantly the opportunity to die due to COVID or acquire severe disease. We should insist on expanding vaccination coverage in connection with other non-pharmaceutical measures to diminish transmission and its impact on public health. And in this context of vaccination coverage, Nicaragua is characterized for having very good vaccine coverage with more than 83%. And I hope I have addressed the question by our colleague from Nicaragua. Thank you.
Thank you, Doctor. From Milenio, Mexico, she says that in the last press briefing, we mentioned several factors that contribute to reinfections due to COVID. And she would like to know what vaccines have shown lower effectiveness to prevent reinfections and what can we do in this regard, Dr. Espinal? Thank you for your question, Blanca Valadez. The answer regarding which one is more or less effective, all vaccines are effective, but one thing is true, no single vaccine is 100% effective to prevent diseases. Vaccines are one more element in the toolbox, but if we have sustained exposure in closed areas indoors and we are not keeping our distance or using our masks, and then we're going to encourage reinfections ourselves. So what is important is to be vaccinated. Why? Because vaccines have shown that they are effective against Omicron variant. So as soon as we get vaccinated, death rates and hospitalization rates go down. So it is important to have that information. People may be reinfected, but what's important is that people recover, that they don't go to a hospital, and that death is avoided. And that is why vaccines, and that's what vaccines are doing. They are preventing those reinfections. There are many factors, but it does not depend exclusively on the effectiveness of a vaccine, and we should not rely exclusively on the power of a vaccine. Thank you very much. Chris Vilches asks, and she's from Zona País, from El Comercio in Peru. She wants to know what are the factors that have made Peru to be the country with the highest rate of monkeypox transmission in Latin America. And so she wants to know what other actions could be used to prevent transmission. Yes, thank you very much for your question. This is Dr. Vacari. Yes, we have analyzed the situation with Peruvian authorities recently, and we need to emphasize that Peru is developing significant strategies to work and also with services of sexual and reproductive health. And so I think a great deal of work is being carried out, including also information to the public. And it is important to follow the chain of transmission and be able to prevent the transmission from continuing. As I said before, it's many times very hard to truly be able to define what are the factors why one country has more cases than others. And there may be multiple factors. In the case of Peru, most likely there they are doing epidemiological surveillance and they are recording cases. There can be also social media networks that are in the community and they are also using them to report. So, but I think Peru is taking good steps to control spread of transmission and following the measures of control. these are important actions that are good for Peru as well as they are good for other countries. So communication, engagement with the communities that are affected at this point is very important. It is essential that we are able to do the work together with these communities if we want to contain transmission. Another part of this is working with the healthcare workers and for them to learn how to recognize this disease, that they can recognize it, that they can detect it, diagnose it, and know what to do in terms of personal protection, but also actions in terms of surveillance and control, which are so important. And finally, I think that it is essential that there be uh, uh, a situation that should be part of the communication to the general population, not to discriminate against some of the groups that may be having more of the virus. And so this is part of the communication strategy. We are coming to the end of our session today. One question from Samuel Fernando from Folha de São Paulo in Brazil about diagnosis of monkeypox. He says Brazil has had an increase in cases in recent days, and at present the country has 4 labs doing sample testing of suspect cases. He wants to know whether it would be important to increase the diagnostic capacity in Brazil to prevent underreporting. What does PAHO think? Dr. Aldigueri. Thank you very much. I'm going to begin my answer by talking about laboratory networks for viral diseases and molecular detection platform. For over 12 years, the region of the Americas, the countries in the Americas, and Brazil have been investing in their laboratory networks. The period of influenza H1N1, followed by the introduction of the chikungunya virus and the challenges with yellow fever, as well as the pandemic since 2020 and the building up of a network for the SARS-CoV-2 virus. So given all of this background, most countries and territories of our region have a diagnostic laboratory for monkeypox. We have it in 28 countries of the region, countries and territories of the region. And the territories that do not have a lab in their own territory do have access, quick access to the networks that are either sub-regional or regional. So in this context, Brazil has a very sound network of laboratories. They have at state level in all states of Brazil, they have labs with the necessary platforms to extend their detection capacity whenever it becomes necessary and according to the epidemiological behavior of the entity. Brazil also has capacity to produce the necessary reagents to do molecular diagnosis using PCR technology. And in fact, the first training workshop for South American countries took place at the enteric pathogen lab of Fiocruz, where a first a delivery of material produced by the molecular biology lab in Brazil was prepared, and they have the capacity to collaborate with the region and have these kinds of exchanges. So the region has its capacity, and it has also the capacity to expand sub-regionally quickly, and there's also a great deal of collaboration amongst the countries. Thank you very much. Thank you. And now we have come to the end of this press briefing today. Please be on the lookout for information about the next press briefing. But we, of course, are always available to answer your follow-up questions. You can send them to media team at paho.org. And also remember that on our website, you can find more information both about COVID-19 and about monkeypox. So thanks again, and we will be in contact with you. Greetings.